Mass General Brigham, its two founding institutions are the Mass General Hospital and the Brigham Women's Hospital. Plus there's affiliate and community hospitals as well as specialty hospitals. We really serve the entire New England area. We're actually the largest private network in the Commonwealth of Massachusetts with over 190,000 IP addresses. With Mass General, we have 78,000 employees. A lot of our clinicians are on site. We have 26,000 people working remotely. A lot of them are benefiting from the Citrix workspace and their remote work. And each of them has a unique set of applications that we like to bundle. And we like to be agnostic to the endpoint device in terms of the delivery of those applications as much as possible. We've virtualized many of our applications, most of the compute either in the cloud or in the data center. I often talk about we have a data center without walls and a network without perimeter. So it's really work from where the work can get done. During this COVID crisis, we went from 9,000 virtual visits a month to last month over 250,000 virtual visits. In fact, we've now hit over 1 million visits virtually since March. A lot more virtualization. That's been key to the delivery of healthcare as well as on the operations side. Our electronic health record is the Epic system, which is one of the major players in the EHR market. And we deliver that over Citrix. For virtual visits, we actually integrated Zoom, and then those are delivered through Epic, through Citrix to endpoints. The other thing we were asked to do is to set up Boston Hope, which was at the Boston Convention Center. And literally in 3 to 5 days, we had an operating hospital. And one of the reasons we were able to do that is we actually used Citrix over Raspberry Pis and really using VDI rather than putting devices out there. It was a great success, and people took note around the Commonwealth. Obviously, the frontline workers, those were the real heroes and the people that really made Boston Hope a success. Some CIOs talk about a cloud strategy. I view cloud as a platform, as part of a continuum from on-prem to hybrid to cloud. Are we going to move more workloads to the cloud? Yes, where it makes financial sense, where we need the elasticity, the ability to burst, where we can have built-in disaster recovery. We're not moving to the cloud just to move to the cloud. It's a business decision, a financial decision, and an operational decision. One area we see is our analytics platform moving quickly to the cloud. We're also looking at Citrix in terms of disaster recovery. Obviously, a lot of software as a service vendors, you end up in the cloud. But the cloud isn't necessarily the end-all, be-all. In fact, there recently was an incident on OpenDNS. We had virtualized our applications in Citrix. We actually had a local cache of DNS that we shifted to, and we were able to recover applications quickly. It's a good example where sometimes a mix of on-prem and cloud can make sense in terms of resiliency. The way we deliver healthcare services in the future, I think the past 5 months has sort of accelerated us. What we thought was going to take 3 years has happened in 5 months. We found that patients are actually very receptive to virtual visits. Some of them prefer it. And I think the other part is the whole remote workforce and how we support that. So we're starting to spend a lot of time. How do we equip people? What are the new policies? We're going to need new tools and ways to support a remote workforce and a virtual environment with our customers. I think it's a new environment, in a sense, probably a new opportunity for Citrix and others to provide the tools to be able to adequately support that environment on an ongoing basis in terms of high reliability, resiliency, and performance.